And turning now to the nation's health, and there were some more sober warnings this week about swine flu as students prepare to head back to the incubators that are classrooms. There are real concerns that the bug could spread and fast. ABC's Rachel Martin joined us from Washington with the latest on all of this. Good morning, Rachel.
Good morning, Bill. It's really the pace of this epidemic that has so many people concerned. It's only August, and federal health officials say already more than 500 people in this country have died because of the H1N1 virus. And as fall and winter approaches, the situation is only supposed to get worse. So the big question now is, are we ready?
The U.S. government hopes so. A recent federal report says worst case scenario, swine flu may infect up to half the U.S. population this year and kill up to 90,000 people. That's double the death rate of the regular flu.
No one really has an immunity to this disease. For whatever reason, the oldest Americans, people over 65, seem to be a little more resilient, but the rest of the population is very susceptible.
Aviation officials are also concerned and taking precautions. In a statement released to ABC News, the Department of Homeland Security says the TSA will work closely with health officials to prevent the spread of the flu and may consider denying boarding in cases where the passengers may be infected. Healthcare workers like Cheryl Peterson are being urged to line up first for the flu vaccine and being told to heed simple advice.
I think the piece that is most important is if you're sick, stay home. And those same measures are needed for healthcare workers.
Some health experts are trying to downplay public fears.
If what we're seeing now is predictive of what we'll be seeing in the fall and the winter, this looks like a mild to moderate, not a very severe pandemic.
Still, Americans are worried. A USA Today Gallup poll released this week says that 1 in 3 people believe they or a family member is likely to contract the H1N1 virus. That's up from 1 in 5 last May.
Just guarded and cautious about where I spend my time, about what I'm doing, about what my general health. I live in a dormitory in D.C. myself, so it's a lot of college kids. So I feel if somebody gets sick, it could affect the whole dorm.
Federal health officials are urging people to go see their doctors and arrange to have the swine flu vaccine, especially children under the age of 5, people over 50, and pregnant women. That swine flu vaccine is expected to be available in mid-October. Bill.